I gain a deeper understanding of essential principles that guide ethical medical practice. I learned the importance of respecting patient autonomy, which allows patients to make informed decisions about their healthcare, fostering a mutual respect and trust. Confidentiality stood out as a critical aspect in preserving patient privacy and upholding a trust between patient and also doctor. I understood the significance of informed consent, emphasizing the effective communication to ensure the patient are fully aware of the benefits and risks of their treatment. The principle of beneficence and non-maleficence taught me to always prioritize the patient's well-being while minimizing the harm. Justice in healthcare highlighted the need for fairness and also equality in treating all the patients um, in the same way, regardless of their background and socioeconomic status. Professional integrity reminded me of the importance of honesty, accountability, ethical behavior in every aspect of medical practice. I also learned how to apply ethical frameworks to make sound decisions. Cultural sensitivity was another crucial lesson, helped me to recognize and respect diverse beliefs and values in patient care, which is very, very important, especially in a multiracial country like Malaysia. Additionally, I realized the duty of healthcare extend beyond the physical treatments, encompassing the emotional and also psychological support which can significantly impact the patient's recovery journey. Lifelong learning, as emphasized throughout the class, importance of updating my skills and also knowledge in order to provide best possible care is also very important. These lessons have shaped my perspective on the responsibilities and challenges that come with being a healthcare professional. These lessons in ethic and values have prepared me to handle complex situations with compassion and also fairness. This has been one of the best PEC group I've been part of, and I'm really grateful for the teamwork and the valuable experience. Thank you.
Hi, my name is Alicia Effendi, and I will be talking about my reflection for PEC300, which is Interprofessional Ethics and Values. So, for my overall reflection, these weekly activities really enhance my understanding of interprofessional ethics and values by combining the theory and also practical application. Each session provided valuable lessons in collaboration, cultural sensitivity, patient centered care, and also the critical role of ethical decision making in healthcare settings. So, for an example, in week 2, which is hosted by group 3, they got the topic of cultural value, custom of belief, and social norm, which they hosted a debate. So the debate allowed us to explore how cultural values, customs, and social norms can influence healthcare practices and decision making. And it's really insightful to hear how healthcare professional can balance respecting patients' cultural belief and also ensure ethical care at the same time. This activity really deepened my understanding of cultural competence and also the importance of empathy and open-mindedness in interprofessional collaboration. And for week 3, which is hosted by group 2, they got the topic of patient's autonomy and also medical consent, in which they hosted a role play. So the role play provided a practical perspective on the challenges surrounding patient autonomy and also informed consent. So watching the scenarios unfold emphasizes the significance of effective communication to ensure that our patient fully understands all of their options, and it also highlighted the ethical dilemma of balancing professional advice and also patient independence and reinforcing the value of shared decision making. And for week 4, we had it was our group to present. We had the topic of patient's privacy and confidentiality, and we played a who is the culprit activity in which that The classroom was our hospital, and one of the team members of the hospital staff has breached the confidentiality code, and then the students have to um, unfold which one of us actually breached the hospital code by going stations by stations. As part of the organizing group, I really gained a deeper appreciation for the ethical responsibility of protecting patients' autonomy. This activity engaged participants in identifying breaches of confidentiality, making the learning process interactive and memorable. So it was very rewarding to see how this activity encouraged critical thinking without about maintaining trust in healthcare settings. And lastly, we have week 5, which is presented by group 4. They got the topic of patient safety and medical errors, where they hosted a charades game. The charades activity actively introduced concepts related to patient safety and also medical errors. The interactive format encouraged active participation and also simplified complex ideas. And we had fun doing the charades in the classroom. We had a lot of laughters, but at the same time, we're also learning something. So overall, working with my peers has really helped me shape into a better person, and this class has really left me with a memorable experience that I can implement further on in my studies and also further on during my internship and also during my working period.
Alright, thank you, Elle. So, for my part, hello, my name is Anis, and I'm here to share about my opinion and reflection on PEC301, which is ethics and values. So, focusing on the weekly activities that we participated in. So, these activities, I believe that it were not just educational but also engaging, as they really allow us to actively apply ethical principles in different scenarios. So let's dive into my reflections of each week. So in the first week, we explore how cultural values, belief, and social norm significantly influence the healthcare practices and patient experiences. And through the debate game, I realized how diverse perspectives shape ethical decision making. And engaging in debates challenged me to critically think about how healthcare professionals should respect cultural differences while maintaining universal ethical standards. It was a thought-provoking way to see how these differences can sometimes lead to some dilemmas in practices. And that's for the first week. The second week's role play activity on the patient autonomy and also medical consent was particularly impactful, and in acting out scenarios made the concept of informed consent feel much more real and emphasize the importance of respecting patients' decision. And it showed me how crucial it is for healthcare providers to communicate effectively and ensure that patients fully understand their options before making any decision. And this hands-on experience highlighted the delicate balance between the guiding to guide the patients and honoring their autonomy too. And then the third week was our game, which was an investigation game. So it was perhaps the most immersive in the investigative gameplay, because walking into the stimulated light medical office, we had to identify who breached the patient privacy and figure out how to prevent future breaches. And this activity emphasized the practical challenges of maintaining confidentiality in a busy healthcare environment. And solving this puzzle really required teamwork, ethical reasoning, and also a keen eye for detail. And I particularly appreciated how this activity combined critically thinking with an ethical lens, and making it both fun and enlightening. And finally, the charades game in the fourth week really brought a lighter yet meaningful approach to patient safety and medical error. And it underscored how errors can occur due to miscommunication, assumptions, or lack of attention to detail. And this activity was a creative way to highlight the importance of teamwork and clarity in the healthcare settings. And while it was entertaining, It also reinforced the serious implication of medical error on patient safety. So overall, these activities were incredibly engaging, insightful, and they allow us to kind of apply theoretical concept in practical scenarios and making the learning process interactive and memorable. And each week offer a unique perspective on ethics and values and enhancing my understanding of the complex challenges healthcare.
So hello everyone, I like to reflect on the past few weeks of our interprofessional education IPE sessions. So during week 2, cultural values, customs of belief and social norms. During this week, we examine how diverse cultural and social norms influence patient care. Our group participated in a debate involving Jamal, a 30-year-old man with severe depression and anxiety. His family believed mental health issues should be addressed privately through prayer and community support, but Jamal wanted therapy and medication. The debate made me reflect on the ethical dilemma of prioritizing patient autonomy while respecting cultural beliefs. I realized that healthcare professionals must navigate these situations carefully, fostering culturally competent care that balances respect for family dynamics with the patient individual rights. Week 3 For week 3, patient autonomy and medical consent, this week focused on the importance of patient autonomy and the process of informed consent. Our group role played a scenario where a cancer patient refused chemotherapy. Prioritizing quality of life over treatment, the family member played by a teammate was distressed and tried to convince the patient otherwise. This activity emphasized the ethical challenge of respecting a patient's rights to refuse treatment while addressing the emotional concern of their loved one. It highlighted the need for clear empathic communication and the importance of ensuring the patient decisions are fully informed and free from coercion. During week 4, patient privacy and confidentiality, in this session, our group participated in an investigation activity where we created a scenario for other groups to determine who breached patient confidentiality. This activity underscored the delicate nature of handling sensitive information and the potential consequences of lapses in privacy. It also highlighted the importance of teamwork and accountability in protecting patient data. This week deepened my understanding of how confidentiality fosters trust and safeguards patient dignity even in complex healthcare settings. Last week, week 5, patient safety and medical errors. In our final session, we played a charade game involving medical terms which made learning about patient safety and medical errors engaging and memorable. This activity emphasized teamwork and effective communication in preventing errors. It also reinforced the importance of fostering a culture of transparency where errors can be reported and addressed without fear of blame. This week reminded me that patient safety is a shared responsibility and a continuous effort to improve care quality. In conclusion, this week have taught me that ethics and values are integral to daily healthcare practice, whether it's respecting cultural norms, championing autonomy, protecting privacy, or ensuring safety. Each topic is a vital component of delivering compassionate, ethical, and patient-centered care. These activities not only enrich my understanding but also equip me with practical skills to navigate real-world challenges. Moving forward, I aim to incorporate these principles into my practice and work collaboratively to uphold the highest standards of healthcare. Thank you.
Okay, so hi and Assalamualaikum. My name is Christina Izzati binti Hasri. My ID number is 012022100135. So I'm gonna give a reflections video based on weeks that we attend in our ethics and value class. So in the first week we didn't attend any game, but we were given introduction to ethics and values. We were divided into 4 subgroups. In my subgroup, we did a ice-breaking session to get to know each other, and we also decide our group name, which is Black Mamba. In the first week, we also given instruction to conduct a game on different weeks based on the given theme. So on the weekend, on Saturday, 19 October, we joined Songket Rhyme for the making of portfolio video 1, IPA PEC301. In week 2, we play debate with theme of cultural values, custom of belief, and social norms. So these debates make so what I learned from this debate make us acknowledge and compare various culture values, customs, beliefs, and social norms from all around the world, such as Jehovah's Witnesses, who are not allowed to receive blood transfusion due to their beliefs. Other than that, such as person with do not resuscitate order who refuse to have CPR attempt on them. So from this debate, I learned that even in any emergency or critical situation, we have to respect their individual choice for their own self. So next in week 3, we make a role play on the theme of patient's autonomy and medical consent. So from this role play, it helps us understand the importance of respecting patient's autonomy or patient choice while handling dilemmas in medical decisions. It means that we have to explain the complex medical procedure to the patient, ensuring they fully understood the risk, benefits, and alternative of the treatment. So and the patient also have right to ask question and decide whether they give consent or they want to refuse the treatment. So this role play showed that informed consent is not just a legal requirement but a key part of a good ethical and healthcare. So next week 4, which is our turn group to conduct a game. So based on team patient's privacy and confidentiality from our games, I learned that we have to respecting the boundaries because patient information should only be shared with authorized individuals, and we cannot simply give their information to anyone who claim to know them because it will become a breach of privacy. Other than that, the electronic and paper medical records must be secure and handled carefully to prevent unauthorized access. So from this game, it helped us understand how to handle sensitive information responsibly, emphasizing trust as a foundation of the patient and us as the healthcare provider relationships. So in the last week, which is week 5, we played charades based on the theme of patient safety and medical errors. So from this charade game, I learned that effective teamwork and communication can help prevent many medical errors, and recognizing error and addressing them is key improving healthcare system. So this charade game helps us understand how small action like clear communication and following safety steps can prevent medical error and protect the patients. So overall from this ethics and value class, I learned that ethics is about determining what is right from what is wrong, and values are the principle that guide our action. So the importance of respecting others' autonomy, belief, and decision, especially in sensitive contexts like healthcare or cultural practice. So that's all the reflection from me. Thank you.
Hi, my name is Farhat, and I will give a brief explanation about the whole PEC. So basically, our PEC was about ethics and value. So during this class, we covered important topics about ethics and values in healthcare, where each group presented and also did some activities for every week. Okay, so basically during the first week, it was about introduction to ethics and values, where during this lesson we learned about the basics of right and wrong in healthcare, which helps us to make fair and good decisions. So moving on to the second week, it was about cultural values, beliefs, and norms. This topic highlighted respect and empathy by showing how healthcare providers must value diversity, and also on how to treat patients with understanding regardless of their backgrounds or beliefs. This showed us how different people's background affect their needs, and also has on how to help everyone with respect. Okay, so moving on to the third week, it was about patient autonomy and consent. So basically, this topic emphasized respect for individual rights and also dignity by ensuring patients have the freedom to make their own choices about their care, where this taught us how to protect patients' personal information and on how to keep it safe. Okay, so moving on to the fourth week, it was about patient safety and medical errors. This topic demonstrated dignity by ensuring patients have their freedom to make their own choices about their care. And also, it taught us on how to protect patients' personal information and on how to keep it safe. Okay, so moving on to the last week, which was about patient safety and medical errors. This topic mostly focused on accountability and care by prioritizing the safety of patients and addressing mistakes in an honest and transparent way. So this taught us on how to avoid mistake and make sure patients are cared for safely. Okay, so for me, this PEC was important because it makes me be prepared to be ready on how to handle real life situation in a responsible and also in a respectful way. Also, each topic showed ethical responsibility of healthcare professionals to act with compassion, fairness, and integrity. Even it was fun by having the activities and demonstrating each topic. Yeah, it was really fun by everyone participating in these activities. Thank you.
Hello everyone, my name is Nguyen. So I'll continue with my reflection on the PEC301 class of ethics and value. So throughout this week, I have learned a lot of important things in clinical scenarios and clinical situations on patient autonomies and patient values, cultures or socials, all those things. So yeah, so actually I also had a great chance to conduct the group activity on our week 4 as puzzle games of patient autonomies and privacy pitch in the hospital. So we start from the week 1, which is introductory week, and it was basically the briefings and our plans to prepare about the ongoing activities that we have to do. So start from week 2, we start with the debate section. It was really enjoying event, and actually it was really eye-opening debate session that I have ever attended, and it was about the patient norms and cultural beliefs and social norms and all those things. So it was really eye-opening because of the scenarios or the situations that the group provide. So it was DNA patients, donor-assisted patients, patient with refused blood transfusions, despite of cultural beliefs and other things. So it was really interesting topics that we divide and we discuss among each other. So in week 3, we also have a role play which is similar to the situations such as patient consent forms or patient's medical errors and all those things. Yeah, patient all those things. So in week 4, it was our weeks, which was the buzzers, and it was fun, interesting, and it was the most difficult. I would say it was the most challenging activity that I have seen and I have probably done throughout my PEC class. Yeah. So thanks to our group members as well. So the last activity was the charade games, which was conducted by other groups on patient autonomy and patient safety and all those things. Despite charade as a game, we have a chance to learn about how important is the patient privacy and patient information, patient details in the hospital scenarios. So it was really it was a huge chance for us to learn, and also throughout those events we have done to improve ourselves in critical thinking, our thought process, and how to manage those situations. For me personally, I tend to believe as clinical workers, we tend to make personal patient assumptions, patient perceptions based on our bias, our previous clinical knowledge, our emotional response, and our assumptions on the patients. We tend to make diagnosis, we tend to focus more on those parts as the clinical workers. Actually, this is not correct. From learning those topics, right? I tend to.
So, hello everyone. I'll be reflecting on my experiences during the past weeks of ethics and value sessions. Each week offered unique activities that helped me deepen my understanding of cultural values, patient autonomy, patient confidentiality, and patient safety. I also participated in some activities and also had the opportunity to host one, making it a rewarding experience and an educational one. So on week 2, we had a debate of cultural values where we discussed about cultural values, we discussed about customs and beliefs. This activity encouraged critical thinking and taught me the importance of respecting cultural diversity in healthcare. Listening to different perspectives helped me appreciate the balance between professional ethics and cultural norms. And on week 3, we had role play, in which I took part as a role play as a doctor, focusing on patient autonomy and medical consent. This activity emphasized the importance of clear communication, empathy, and informed decision making. It was a great way to apply theoretical knowledge in practical setting. And on week 4, which was hosting investigation activity, it was done by our group, and I was the host, and which the theme was about patient privacy and confidentiality. So the participants had to solve mystery through stations where they were given mysteries, and they have to highlight out who's the culprit from that. So highlighting the consequences and to show who breached the confidentiality law. So hosting me helped me develop leadership and organizational skills while reinforcing my own understanding of privacy. And on week 5, we had charades on patient safety, in which I participated in a charade session on patient safety and medical errors. It was fun yet impactful way to learn about serious topics like medication error. It also improved my ability to communicate complex ideas, like we had to give them out in gestures. So overall, looking back at all these activities, it provided me a well-rounded understanding of ethics and values in healthcare. So as a participant in week 2, 3, and 5, I had a chance to engage directly with the content and gain new perspective. Hosting the activity in week 4 was entirely different, since I was a host, and that experience allowed me to step up as a leader and contribute to my classmates' learning. The debate in week 2 taught me how to respect cultural diversity. The roleplay in week 3 emphasized the importance of patient autonomy and effective communication. The hosting of investigation activity in week 4 strengthened my leadership and organizational skills while deepening my understanding of privacy and patient confidentiality. Finally, participating in charades during week 5 showed me how serious topics like patient safety can be communicated in a fun and engaging way. So these activities help me grow in many ways, in which some aspects like improving my public speaking, my teamwork, my leadership skills, and especially reinforcing key ethical principles that will guide me as future healthcare professional. Thank you.